Hi there. Today we'll be discussing H1 antihistamines. In particular, we'll be discussing its background, clinical uses, mechanisms of action, and side effects associated. Before discussing antihistamines, we must first outline the action of the mediator we are competing with, which is histamine. Histamine is a primary inflammatory agent of the human body that is secreted in response to irritants such as dust, pollen, and certain foods. Due to this, histamine is released in areas where the first site of exposure is most common, such as within the lungs and skin tissue. Histamine is primarily located within the mast cells and circulating basophils. These immune cells store histamine in secretory granules ready to be released to act on certain histamine receptors. There are 4 different types of currently known histamine receptors: H1, H2, H3, and H4. When each type is activated, responses will vary. However, in today's presentation, we'll be focusing on the main histamine receptor, H1. An example where histamine is released in large amounts is when a hypersensitivity reaction occurs, such as an allergic reaction. Allergic reactions are formed through 2 stages, first and second exposure. The stages of allergy formation can be seen summarized here.
Examples of inflammatory responses caused by histamine include increased vasodilation causing flush, stimulation of sensory nerves leading to a feeling of pain or itch, and stimulation of vomiting as well as more. These are examples of the effect of H1 histamine receptor activation. These responses are an effective defense mechanism when triggered by a foreign pathogen. However, when triggered by usually safe agents, such as certain foods, the response is inappropriate and causes unnecessary discomfort. This introduces the need for the use of H1 histamine receptor antagonists for people who experience conditions such as allergic rhinitis and motion sickness. The H1 receptor antagonist works to reduce the symptoms of inflammation and can interrupt the nausea pathway. There are 2 main classes of H1 antihistamine, first generation and second generation. The first class of drug is also referred to as sedating antihistamines. For example, diphenhydramine, which is marketed under the name of Benadryl. The naming of the drug is also due to the fact that they can act as muscarinic cholinergic blockers in the CNS. They are able to do this because of their high lipophilicity and therefore are able to cross the blood-brain barrier. This characteristic causes the drug to mimic atropine-like effects such as drowsiness. This class of drug acts as competitive reversible H1 receptor antagonists. They are administered orally, making the treatment more convenient and less invasive. Whilst the drug is effective in treating allergies, it also comes with side effects due to depressive CNS action such as drowsiness, as mentioned before. Additionally, blurred vision and dry mouth often occur as a result due to the inhibition of muscarinic receptors. A later class of H1 antihistamines was developed in order to eliminate the drowsiness side effects, as some people are unable to take the first generation of H1 histamines, as it will impact their daily lives negatively. For example, if they drive heavy machinery for a living, taking this class is not ideal. H1 second generation antihistamines are administered and act in a similar way, however with reduced cholinergic effects. Although this is the case, H1 second generations still trigger side effects. Due to the nature of the drug, it is metabolized in the liver by the cytochrome P450 enzyme. This can be problematic if a patient already taking another medication that is broken down by the same enzyme, or if taken in excess. This then results in more antihistamine being present in the body and for longer, leading to potential cardiotoxicity. This is a summary of the action of H1 antihistamines, including the sites of adverse reactions. However, do remember that second generation H1 antihistamines have reduced effects on the cholinergic receptors.
An example of a clinical use of H1 antihistamines is used when treating emesis, also known as motion sickness. Motion sickness is triggered by excessive motion, for example, when you're on a boat or in a vehicle. The vomiting and nausea pathway begins when there is a mismatch between the information your eyes see compared to your inner ear balance mechanism. This information is sent to the vestibular nuclei where histamine receptors are present. Histamine is released from the hypothalamus in response and activates the H1 receptors. This activation alerts the chemoreceptor trigger zone to then alert the CNS vomiting center, therefore leading to symptoms of nausea and vomiting. Antihistamine is thus used to antagonize the H1 receptors located in the vestibular nuclei, interrupting the pathway to avoid nausea and vomiting. In summary, the key points that were covered: H1 first-gen antihistamines are ideal for nighttime relief of allergic symptoms and also to treat emesis. H1 second-gen antihistamines are ideal for allergy treatment without the side effects of drowsiness. Antihistamines are one of the most commonly used pharmaceuticals. All in all, the benefits outweigh the side effects.